Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Galactorrhea. Introduction. Galactorrhea is a condition where a milky substance leaks from the nipples. This condition is not related to pregnancy or breastfeeding. Galactorrhea usually happens in women, but it can also happen in men and babies. Galactorrhea is usually not a problem, but it could be a sign that something else is wrong. This program explains the symptoms and causes of galactorrhea. It also talks about possible treatment options. The breasts and the nipples. The breasts are made up of fatty tissue and glands. These glands make, store, and deliver milk after a pregnancy. They respond to many of the female hormones such as estrogen. Cells inside your breasts make milk. Prolactin is a hormone that is made in the pituitary gland, which sits at the base of the brain. Prolactin tells breast cells to make milk. The milk is made and stored in the glands inside the breast tissue. Milk flows from the glands through the ducts and out of the nipples. The ducts open into many tiny openings in the nipple. The milk then passes through the nipple area to the outside of the breast. Galactorrhea. Galactorrhea is a condition where a milky substance leaks from the nipples. Having too much prolactin causes galactorrhea. Prolactin stimulates the cells in the breasts to make milk. Galactorrhea is not related to pregnancy or breastfeeding. The milky discharge caused by galactorrhea is different from the normal milk made during breastfeeding. Galactorrhea is not a disease, but it could be a sign of another health problem. Galactorrhea usually happens to women. In some cases, men and babies can also experience it. Sometimes galactorrhea will stop on its own.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms. A milky discharge from one or both breasts is the main symptom of galactorrhea. Sometimes this will be the only symptom. Discharge caused by galactorrhea does not have any blood in it. It leaks from more than one milk duct. It may come out when you squeeze the nipples, or it may leak out on its own. People with galactorrhea may also have acne or hair growth on the chin or chest, headaches, problems dealing with hot or cold temperatures, thirstiness, the need to urinate more often. People with galactorrhea may also experience a lower sex drive, loss of periods in women, vision problems, weight loss or gain. Men with galactorrhea may have problems getting an erection. Causes. Galactorrhea usually happens when your body makes too much prolactin. The pituitary gland makes prolactin. The pituitary gland is a tiny organ at the base of the brain. The gland makes hormones that control other glands in the body. Tumors of the pituitary gland may cause galactorrhea. Galactorrhea can be caused by too much breast stimulation from frequent breast self-exams, clothes that rub against your nipples, sexual activity that involves the breasts. Galactorrhea may also be caused by birth control pills or other medications, chronic kidney disease, herbal supplements, and underactive thyroid gland. In men, galactorrhea might be related to low levels of the hormone testosterone. Nipple discharge may happen along with breast growth and tenderness. Galactorrhea can also happen in newborns. This is caused by high levels of certain hormones. Hormones pass into the baby's blood while the baby is in the womb. Galactorrhea in babies usually goes away in about 2 weeks. Diagnosis. A milky discharge from your nipples is not always a problem. See your healthcare provider if you are not pregnant or breastfeeding and you have discharge that does not stop after a week. Contact your healthcare provider if you are having other symptoms. Your healthcare provider will ask about your symptoms and medical history. A physical exam will be performed. The physical exam will include a breast exam. If you are a woman, your healthcare provider will do a pregnancy test to rule out pregnancy as a possible cause. Your healthcare provider may gently squeeze your nipple or press the area around it. They will check to see if the discharge comes from one nipple duct or several. Your healthcare provider may run other tests to look for changes in your breasts. These may include a CT scan or an MRI, a mammogram, an ultrasound. Your healthcare provider may not be able to determine why you have galactorrhea. Your breast tissue may be too sensitive to the prolactin in your blood. Even if the cause of your galactorrhea is unknown, treatment is still available. Treatment. Sometimes galactorrhea can go away on its own. Avoiding contact with your nipples can help symptoms go away. Avoid breast stimulation by not squeezing your nipples to check for discharge, not touching your nipples during sexual activity. You should also only do breast self-exams once a month. Wear clothes that don't rub against your nipples. Treatment will depend on what is causing your galactorrhea. If it is caused by a medication, your healthcare provider may recommend that you stop taking it, change your dose, or switch kinds. If galactorrhea is caused by an underactive thyroid or a pituitary tumor, there are medications that can help. Pituitary tumors can also be taken out through surgery. If the cause is unknown, there are medications that can lower how much prolactin your body makes. While you are being treated or waiting for galactorrhea to go away, you may still have discharge. Wearing breast pads under your clothes can help prevent nipple discharge from leaking through your clothes.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Galactorrhea is a condition where a milky substance leaks from the nipples. It is not related to pregnancy or breastfeeding. Galactorrhea can happen to women, men, and babies. It is not a disease, and sometimes it goes away on its own. A hormone called prolactin sends a message to breast cells to make milk. Galactorrhea can happen when your body makes too much prolactin. Leakage is usually the only symptom of galactorrhea, but some may notice other symptoms such as acne or hair growth on the chin or chest, headaches, thirstiness, a lower sex drive. Galactorrhea is often caused by problems with the pituitary gland. Certain drugs, hormone problems, or breast stimulation can cause galactorrhea. Galactorrhea doesn't always require treatment. See your healthcare provider if you are not pregnant or breastfeeding and you have had leakage for a week. Treatment for galactorrhea may depend on what is causing it. Avoiding nipple stimulation may help prevent symptoms. There are medications available that can help if it does not go away on its own. Thank you for using Explain.